Let's jump into this and I'll show you why we call this the MYK Brain, because it does all the thinking for you. So if we go under select nerve right here, you can go right into any treatment that you want. So we have C1 through T1, and then we have L1 through S2. To get into the thoracic information, you got to take the third class to get into that. But for this, you can just get into this information. If I just click on C5, it just pulls up adjust C5. There's an extra specific treatment, 4 minutes to do that with an adjustment. Or you can come down and do the full, this is a soft tissue treatment. You can do the full treatment. It's almost 10 minutes. We have a treatment flip chart is what we call it. And it has a before and after picture to go through the movements and show you what that is. So let me get into, if I click the logo up here, I can go right back to the main page. Let's go under select posture. I just want to show you some of the stuff in here. So if we go under the head and shoulders area, so the first thing we have how to evaluate each section. And so if you click on that, it shows you how we...
All right, now we're going to evaluate the scapula.
So it shows you how we go through it. And I'm not going to go through the video, of course. So here's the examples. Now, this is pictures that we took of actual patients and students over about a 5-year time frame. We ended up, if you were to watch each one of these videos, each video contains basically one of these postures, a sample of each one, and we go through and explain, why we're calling it or why we're not calling certain postures. And it's just a practice area to go through how we're doing postural analysis. If you were to do all the upper and all the lower videos in this, it would be the equivalent of about 100 full body postural analyses. So let's get in and look at if we found somebody and we're going through and we go, okay, they have an extended head, they have an elevated scapula, which gives us a depressed scapula right away. If they had an abducted or a protracted scapula, we have an abducted shoulder. And the last one is going to be a medially rotated shoulder. We don't find anything in the forearm, so we come down into the lower body and we have an abducted. Now the lower body has the same thing, how to evaluate videos and the sample practice areas as well. So you get full access to all that information there. So if we go for the hip, we have abducted and adducted and a medially and laterally rotated hip or pelvis, and then we get into the foot, and we've got a dorsiflexed and a big toe that is extended. So those are the things that we found. And then all we do with this, the check marks say we found something, we just hit calculate. And so it came to 2 different nerves in the upper body. And so it's going to ask us symptoms associated with those 2 nerves that it's trying to differentiate. So we've got named conditions, we've got nerve pain, and we've got painful or weak movements to help us differentiate. So I'm going to keep it at 2 just to show you what happens next. So if we can't narrow it down from there, we're going to hit submit. So it comes to C3 and C5. So now we're into a muscle testing area. And if I don't know how he muscle tests. You don't have to muscle test the way I do. But here's a sample of...
All right, now we're going to test the anterior deltoid. And the way we're going to do this is we're going to have the person bring their arm up.
And so we go through and show you how we muscle test. So let's say that we found a difference from left and right side on that muscle. And we go, cool, you got a C5 problem. So with the brain, it comes in, it says, look, you're going to adjust C5, and you can do the extra specific treatment of this, which is 4 minutes and 22 seconds. If you do the adjustment and the extra specific treatment, you do that a few times, and the patient's not responding, you may want to drop down and do the full treatment of this. And we get very, very good results. And once you get the treatments down, you don't necessarily want to watch the video, so you can hit this treatment summary, and this is our treatment flip chart. And it gives you a before and after picture and all the muscles that you're going to treat through there for the treatment. Then you look at, well, down here, we've got the therapeutic exercises that we can give someone. So what I look for is just the percentages to be double of anything else. So what this tells me is the rhomboid's almost double of all the others. So the rhomboid showed up in 2 of their postural imbalances. So you can either print this out and give this to the person. You may have better exercises than I do, but these are very specific to the muscle that we're trying to strengthen for the person. And so you can click on this and say, yeah, I'm going to send them those 2, and you can email that over, and it'll email it to yourself, and then you can forward it on to the patient if you want. You can save the treatment page and it will save, here's all the things that we found, all the postures that we found. So it saves all of that information. It saves the treatment information. It saves all the reinforcement information. That's the primary, C5. Then we go into the secondary that we found, which was an S1. So you can do an S1 adjustment and the extra specific treatment, again, about 4.5 minutes. If you do a number of those and the patient's not responding like they should, then you can jump down here and do a full treatment. Now, the lower body also has single position treatments, so that for the patients who can't roll over, they can't lay on their stomach, they can't lay on their side, what have you, it's all from just laying on their back. We also have exercises down here. So this tells me that the big toe flexors and the gluteus minimus showed up in 2 postural imbalances. The rest showed up in 1. And I'm going to send them home with those 2 exercises right there. And you can save the treatment information, and it'll send a PDF over, and then it's a writable PDF. So you can actually type on it and save your notes and everything that way. That's a pretty good overview right there, pretty quick. So let me know if you have any questions.